Hi, I'm Dr. Dhruv Kumar, Professor and Head at the School of Health Sciences and Technology, UPES, Dehradun. World Head and Neck Cancer Day is observed annually on 27 July. This is not just a date on the calendar. It's a global call to raise awareness, to educate, and to act. Let me begin by sharing some eye-opening facts about head and neck cancer. Globally, over 900,000 people are diagnosed with head and neck cancers every year, and around 450,000 of them lost their lives. This group of cancers is now ranked as the sixth most common cancer worldwide, and it affects men nearly 3 times more than the women. We are dealing with a major global health challenges because of this head and neck cancer. And the situation is even more worse in India. If you see the data, you will be surprised to know that India has nearly 30% of the global burden of head and neck cancers. Each year, we see over 135,000 new oral cancer cases in India. And among Indian men, oral cavity cancers has become the number one most common cancer. The highest incidence is reported from Delhi, Uttar Pradesh, Bihar, MP, Rajasthan, and West Bengal. But this is a national concern. So what exactly head and neck cancer is? It starts from the lip, oral cavity, tongue, throat, nasal cavity, larynx, and it goes to the pharynx. Up to all these regions are the part of head and neck cancer. So most of these are squamous cell carcinoma. It means head and neck cancer start in the squamous cell lining of the tissues. There is a rising trend of cancers caused by HPV infection, specifically in the younger population. It affects the oropharyngeal region, and now the trend is increasing of oropharyngeal cancer. So now let's talk about the cause of head and neck cancer. The biggest culprit for head and neck cancer is tobacco, both smoked and smokeless tobacco, which are responsible for nearly 90% of the head and neck cases. Alcohol, specifically when combined with tobacco, the intensity or increases the risk of head and neck cancer. When tobacco is combined with alcohol, actually synergizes the effect of head and neck cancer. Another is very, very important cause is HPV infection. Especially HPV 16 and 18 is becoming a significant factor in oropharyngeal cancers. Other causes may include betel nut chewing. That's a significant factor that is contributing in head and neck cancer. In India, specifically, people they use gutka and pan masala, and of course, the poor oral hygiene is also contributing to the head and neck cancer, oral cancer. Some of the occupational exposures to substances like asbestos and other chemicals, wood dust, these are also one or other way contributing to the head and neck cancer. Actually, head and neck cancers are often curable, but only if detected early. That's why knowing the symptoms of head and neck cancer is very, very important. For example, mouth ulcer that does not heal, or change in voice, or let's say lump in the neck, or difficulties in swallowing or breathing, or if you see red or white patches in the mouth, or persistent sore throat. If you see or someone you know experiencing these kind of symptoms, then don't delay. Seek medical help immediately. contact doctors, go to the hospital, seek their advice. Early diagnosis is important for the right treatment. We all know. And if it is diagnosed early, then clinician can provide you the best treatment. Actually, treatment depends on the stages of the head and neck cancer. But it may include surgery, radiation, chemotherapy alone or in combination. That depends on the stage. Or some specific marker, if clinicians they identify, then they can advise targeted therapy or even immunotherapy. It helps in a big way. Actually, head and neck cancers are mostly preventable. You can significantly reduce your risk by stopping tobacco and alcohol, getting HPV vaccine, especially when at the age of 9 to 26. Avoid a betel nut chewing or this tobacco, maintaining oral hygiene, and doing regular screening, especially if you are in the high-risk group. There are many brave survivors, are living example of head and neck cancer that early detection and timely treatment can lead a fully recovery from head and neck cancer. Let's make sure we support them and inspire others to come forward. So what we can do, let's spread awareness in our communities. Remember, a small act of awareness can save a life. Thank you. Let's commit ourselves to this cause, because every voice, every action, and every effort matters.